All right, welcome in everyone to another deep dive. Today we're tackling something that's uh, incredibly important, I think, but not always talked about as openly as it should be. We're going to be talking about the postpartum period,
Mm.
that time after childbirth. It's a huge transition, and we really want to get into what that actually looks like.
Yeah, absolutely. It's such a key period, and the resources you've pulled together are really fantastic for this deep dive. We've got some great stuff from a podcast that focuses on women's health, and then also some really detailed information from the Cleveland Clinic on what exactly happens during those postpartum weeks and months.
Yeah, so we're going to unpack all of that. We're going to try to get a clear picture of like what changes happen physically, emotionally, how long they last, and most importantly, what everyone needs to know to take care of themselves during this time.
Right. Exactly.
Uh,
Because it really is a major, major transition.
okay, so let's start with the basics. When we talk about postpartum, what exactly are we talking about?
So technically, the postpartum period starts right after you give birth. And generally, doctors and midwives will say it lasts around like 6 to 8 weeks.
Okay.
You might also hear it called the postnatal period. But here's the thing. Even though people often say 6 to 8 weeks, the truth is that all those physical and emotional changes you go through, they can last a lot longer than that. We're talking months for some people. It's not like there's a hard stop at 8 weeks and everything goes back to
Well,
normal.
so it's more of a gradual process, kind of.
Yeah,
Yeah.
exactly. It's a gradual return to your pre-pregnancy state. But I think it's really important to just acknowledge right off the bat how massive giving birth is. I mean, it's physically intense, emotionally intense, and then on top of all that, you're suddenly taking care of a newborn. So, yeah, it's a lot to adjust to.
It's a lot, yeah.
Yeah.
Okay, so I noticed that the Cleveland Clinic, in their information, they actually break down the postpartum period into different stages. And I thought that was a really interesting way to look at it. Can you tell us a little more about that?
Yeah, they do. And a lot of healthcare providers will think about it this way too. So there are three main stages. The first one is called the acute phase, and that covers like the first 6 to 12 hours right after delivery.
Okay.
This is a pretty critical time because during those first few hours, there's a slightly higher risk of some serious complications. Not super common, but things like eclampsia, which is when you have seizures because of high blood pressure, and postpartum hemorrhage, which is basically really heavy bleeding.
Okay.
So, yeah, because of those possibilities, the medical care in those first few hours is really focused on monitoring your vital signs, making sure your blood pressure is okay, checking for bleeding, things like that.
So that first, like, half day or so is when they're keeping a really close eye on you.
Yeah, exactly.
Okay. And then, so what comes after that?
So then you move into the subacute phase, and this lasts from around 24 hours after birth up to like 2 to 6 weeks. Now, the risk of those really big emergencies goes down, but your body is still going through a lot of changes internally. So, healthcare providers are still watching for things like cardiomyopathy, which is a problem with your heart muscle.
Mm.
And they're also watching for signs of postpartum depression, which can start to show up during this time.
Okay.
Yeah. So, it's still a time when close monitoring is super important.
Got it. And then there's one more stage after that, right?
Exactly, the delayed phase. And this one, it goes from 6 weeks all the way up to 6 months after childbirth.
Wow. Okay.
Yeah, the changes that are happening now, they tend to be more gradual. Like your muscles and tissues are still recovering, slowly getting back to where they were before pregnancy.
Right.
And it's often during this phase that doctors or midwives might address things like, if you're having problems with your pelvic floor or if sex is painful. So yeah, you can see how the focus kind of shifts as you move through those stages.
Yeah, that makes a lot of sense. It really highlights that, recovery isn't just like this one, chunk of time. It's like different things are happening at different points.
Right. Exactly.
Okay, well, let's talk about some of those things that are actually happening. The sources we have, they talk about a lot of different physical symptoms that people might experience after they give birth.
Yeah, there are definitely a lot of normal physical changes. And one of the first big ones is something called uterine involution. That's just a fancy medical term for your uterus shrinking back down to its regular size.
Oh, okay.
And this process can actually cause some cramping, which people often call afterbirth pains. And then you also have vaginal bleeding, which is called lochia. This whole process of the uterus shrinking back down can take up to 6 weeks. So it's a pretty big change happening inside your body.
6 weeks. Wow. So, okay, and I know, like, the bleeding changes over time, right? It's not always the same.
Yeah, you're right. So at first it's a bright red flow, and then as the weeks go by, it gradually turns more brownish, and then eventually it's like a light brown or yellowish discharge before it stops completely.
Huh.
And it's important to use pads to manage the bleeding, not tampons.
Yeah.
Yeah, just to be extra safe and avoid any risk of infection. And another thing to keep in mind is that those afterbirth pains, the cramps, they can sometimes feel worse when you're breastfeeding.
Oh, really?
Yeah, and that's because breastfeeding releases hormones that help the uterus contract more. So it's kind of doing its job a little more intensely.
Okay, interesting. What about other soreness? I mean, vaginal birth, it can be pretty intense, right?
Yeah, it definitely can. And a lot of people experience what's called perineal soreness. That's basically discomfort in the area between the vagina and the anus. It's super common, especially after a vaginal delivery. The sources actually say that up to 70% of people will have some tearing during childbirth. Yeah, so this area can be really sore and swollen for a few weeks. And simple things can help, like sitting on a pillow to take some pressure off, or using warm water rinses after you go to the bathroom. There are these special bottles called peri bottles that are really helpful for that.
Okay.
And you can also use like cold sanitary pads just for the soothing effect. And then, of course, if you've had a C-section, well, the incision is going to be sore for a few days, and it can take up to 12 weeks for the deeper healing to happen.
Right.
So, yeah, it's important to watch both those areas, any tears or incisions, just to make sure they're healing okay and there are no signs of infection.
Okay. Good to know. And then, of course, there's the whole thing with your breasts, with milk production starting. I've heard a lot about engorgement. What can you tell us about that?
Yeah, so breast engorgement and nipple pain, they're both really common as your milk starts to come in. That usually happens a few days after you give birth. And it can happen even if you're not planning to breastfeed.
Oh, interesting.
Yeah, because your body just naturally starts making milk at first.
Right.
And your breast can get really swollen and firm and sore. It's pretty uncomfortable. If you are breastfeeding and you're having like cracked nipples or a lot of pain, lactation consultants can be super helpful. They can show you different positions and make sure the baby's latching on correctly, which can make a big difference in how much it hurts.
Right.
Yeah.
Okay. That makes sense. So it sounds like there's a lot going on physically. And hormones play a big role in all this too, right?
Huge role, yeah. After you give birth, your hormone levels, they just plummet. Like estrogen and progesterone, they drop really quickly, which is kind of like going through a sudden withdrawal.
Oh, wow.
And that can cause all kinds of symptoms like hot flashes, mood swings, headaches. Those are all really common in the first few days. And you might also sweat a lot, especially at night.
Okay.
Yeah, it's your body just trying to get everything back in balance.
Interesting. Now, what about swelling? I remember that from pregnancy. And I'm just curious, does that go away right away after you give birth, or?
It takes a little time, yeah.
Mhm.
So during pregnancy, your body holds on to a lot of extra fluid. And then in that first week or so after delivery, it starts to get rid of all that extra fluid.
Okay.
And that can show up as swelling, usually in your feet and ankles.
Right.
But, usually it's just your body doing its thing. But, and this is important, if you have swelling and you also have chest pain or trouble breathing, that could be a sign of something more serious. So definitely call your doctor right away if that happens.
Okay, good to know. Yeah, I mean, I can only imagine how exhausted you must feel after giving birth. And then, you have a newborn who needs care all the time.
Yeah, the fatigue is real. I mean, labor and delivery is tiring enough. And then you add in the constant demands of newborn care, the
Mhm.
feeding, the sleep deprivation.
Yeah.
It's a lot. So, yeah, you're going to feel tired, and that's totally normal. It's really important to rest whenever you can, even if it's just like short naps when the baby's sleeping. And don't be afraid to ask for help. Let people bring you meals, let people help with chores, whatever you need to get some rest.
Yeah, that's so important. The sources also mention some other physical symptoms, some things that, maybe aren't as fun to talk about, but like constipation and hair loss. Are those normal too?
Yeah, totally normal. So constipation is pretty common after giving birth, and it can be because of a few different things, like maybe you had pain medication during labor, or you had an epidural, which can sometimes slow down your digestion.
Okay.
And some people are just scared to poop because they're sore.
Yeah, that makes sense.
Yeah, so if you're having trouble, you can talk to your doctor. They might recommend a stool softener or something like that. And then hemorrhoids, those are also common, unfortunately, just because of all the straining during labor.
Right.
And then the hair loss, yeah, that's because of the hormone changes. You might notice you're shedding more than usual, but it's usually temporary, so
Right.
try not to stress too much about it.
Okay, good to know. It sounds like your body is going through so much.
It really is. It's like a whole other process after the pregnancy itself.
Okay, well, let's shift gears a little bit and talk about the emotional side of things. The sources also talk a lot about, the emotional changes that are common after you have a baby.
Yeah, for sure. It's not just about physical recovery. The emotional landscape can be pretty intense too. And a lot of new parents, they experience what's called the baby blues.
Yeah.
And that's basically feeling sad or tearful, maybe a little irritable. It usually starts in those first few weeks after giving birth. And the good news is that the baby blues, they're super common and they usually go away on their own within a couple of weeks.
Okay.
Yeah, it's just your hormones adjusting and you getting used to this whole new life.
Right. But then there's also the possibility of postpartum depression, which is different.
Right, exactly. Postpartum depression is more than just feeling a little down. It's a much more serious and long-lasting type of depression. It's feeling really sad and hopeless, and maybe you lose interest in things you used to enjoy. And these feelings, they don't just go away. They can make it really hard to take care of yourself and your baby. So if you're feeling this way, it's important to talk to your doctor. There are treatments that can help, like therapy or medication.
Right.
It's important to know the difference between the baby blues and postpartum depression and to get help if you need it.
Yeah, absolutely. And anxiety can also be a problem after childbirth.
Right, definitely. Postpartum anxiety is when you have a lot of excessive worry after having a baby, and it can sometimes come with physical symptoms too, like a racing heart or trouble sleeping, even when the baby is asleep.
Okay.
And the thing is, postpartum depression and postpartum anxiety can actually happen together. So again, if you're feeling really anxious, don't hesitate to reach out for help. There are treatments that can make a big difference.
That's good to know. So, what about body image? That's a big thing for a lot of people, and I imagine after pregnancy and childbirth, it must be a big adjustment.
Yeah, for sure. It's totally normal to have loose skin, stretch marks, and changes in your body shape after you have a baby. And it's understandable to be thinking about your weight and how your body looks.
Right.
But the sources we looked at, they really emphasize that it's important to focus on being healthy, eating nutritious foods, and taking care of yourself rather than trying to lose weight right away.
Yeah.
You will lose some weight naturally. I mean, usually there is an initial drop of around 10 to 20 pounds right after birth, but the rest takes time. It's important to be patient with yourself and remember that your body has just done something amazing.
That's such a good point. Okay,
Hmm.
so we've talked about a lot of things that are considered normal after childbirth, but the sources also talk about, when things might not be normal, when you should call your doctor.
Yeah, that's really important. So even though a lot of things we've talked about are totally typical, there are some signs that could mean something more serious is going on. So it's always better to be safe than sorry. If anything feels off or if you're just not sure, call your doctor.
Okay, so what are some of those more serious things that people should be aware of?
So some of the big ones are postpartum hemorrhage, which is when you have really heavy bleeding after delivery. And then there's postpartum preeclampsia, which is a condition with high blood pressure and protein in your urine. That
Yeah.
can actually happen even after you've had the baby.
Oh, wow.
Yeah, and then there's deep vein thrombosis, which is a blood clot in a vein, usually in your legs. And that can sometimes lead to a pulmonary embolism, which is when the blood clot travels to your lungs.
Okay.
And then on the mental health side, there are more severe conditions like postpartum rage or even postpartum psychosis.
Right.
And then there's sepsis, which is a serious infection. So, yeah, there are a few things to keep an eye out for.
Those sound really scary. Are there, specific symptoms that should make someone call their doctor right away?
Yeah, definitely. So if you have heavy vaginal bleeding, like soaking through a pad every hour for several hours, or if you notice that the bleeding is getting heavier again after it had started to slow down, definitely call your doctor. And also, if you're passing big blood clots, especially if they're bigger than a quarter, that's a sign to call. And then fever, if you have a fever higher than 101 degrees Fahrenheit or 38 degrees Celsius, that's also concerning.
Okay.
And then new or worsening pain anywhere in your body. If something just doesn't feel right, call your doctor. And then foul-smelling vaginal discharge, pain in your legs or ankles, especially if they're swollen or red, any pus or blood coming from a C-section, incision, dizziness, changes in your vision, really bad headaches that don't go away.
Okay, so a lot of different things to watch for.
Yeah. And then also chest pain or shortness of breath. Those are really important. If you have those, get medical attention right away.
All right, so what about mental health? When should someone reach out for help with their mental health during this time?
Yeah, so if you've been feeling really sad and hopeless for more than a couple of weeks, or if you just don't feel interested in your baby or in doing things you used to enjoy, It's really important to talk to someone. And the same goes for anxiety. If you're constantly worrying and it feels like you can't control it, or if it's interfering with your life, reach out for help. And I really want to emphasize this. If you ever have any thoughts of harming yourself or your baby, that's an emergency. Call 911 or the Suicide and Crisis Lifeline at 988.
Yeah, that's so important to remember. There's help out there, and you don't have to go through this alone. Okay, well, let's talk about some things that can help. What are some self-care strategies that can make this time a little bit easier?
So first and foremost, rest is essential. I know it's hard with a newborn, but it's so important.
Right.
Don't be afraid to ask for help from your partner, family, friends, whoever. Let them help with the baby, with chores, with cooking. Do whatever you can to get some rest.
Yeah, delegate.
Exactly. And then paying attention to your nutrition is also key. Drink lots of water, eat healthy foods, things like fruits, vegetables, lean protein, whole grains.
Okay.
That'll help your body recover and give you more energy. And it can help with constipation too, which is a bonus.
Right, right. What about things for, like, physical comfort?
Mm.
Things that can help with soreness and things like that.
Yeah, so for perineal soreness, definitely follow your doctor's instructions. They might recommend using a peri bottle to rinse the area after you go to the bathroom, or using witch hazel pads or those cooling pads.
Okay.
And then for exercise, at first you'll need to take it easy, but your doctor can tell you when it's safe to start working out again. Start slowly, maybe with some short walks, and gradually build up from there.
Right.
And then, of course, don't forget about your mental health. If you're feeling overwhelmed or stressed or down, talk to someone. Talk to your partner, your friends, your family, or talk to a therapist.
Okay.
There are also support groups for new parents, which can be really helpful. And sometimes just simple things can make a difference, like taking a bath, reading a book, whatever helps you relax.
That's great advice. And then I know doctors usually schedule checkups after you have a baby. Those are important, right?
Super important, yeah. Make sure you go to all of your postpartum appointments. It's a chance for your doctor to check on your recovery, make sure everything's going okay, and answer any questions you have.
Right.
They can also talk to you about things like birth control and when it's safe to go back to your normal activities. So, yeah, those checkups are really important.
All right, well, we've covered a lot of ground today.
Yeah.
Is there, like, one big takeaway that you would want people to remember from all of this?
Yeah, I think the biggest thing is to remember that the postpartum period, it's a big adjustment. It's a lot to go through, but you're not alone. Lots of people experience these same things.
Right.
So be kind to yourself, rest, take care of your body, ask for help when you need it, and don't hesitate to reach out to your doctor if you have any concerns at all. Your recovery is just as important as your pregnancy was.
So well said. I hope this deep dive has been helpful for everyone listening. It's a lot of information, but I think it's so important to understand what to expect and to know when to ask for help.
Yeah, definitely. And remember, your body has done something incredible, and it deserves time and care to recover.
Exactly. If you're going through this right now, or you're getting ready to, just take a moment to think about what we've talked about today. What stands out to you? What questions do you have? Maybe talk to your doctor or a trusted friend or family member.
It's different for everyone, but knowing what's normal, knowing what to watch out for, and knowing that you're not alone, that can make all the difference.
All right. Thanks so much for listening to our deep dive.
It was great to be here.
We'll see you next time.
See you then.